I'd like to just give a brief bio about Dr. Irons. Dr. Irons is from the first year residence at the Canadian College Naturopathic Medicine, and she is also the supervisor in the satellite clinic at 333 Sherbourne, a clinic catered for people living with HIV and AIDS. And she's going to talk about tonight is understanding the blood work and how to improve your quality of health through naturopathic medicine. Dr. Irons, why she wanted to pursue as a career in medicine, because she loved, to understand the body and learn how it works. As a doctor herself, she wants to have the patients to taking control of their own quality of health, eliminating fears, and making the right healthy decision. And without further delay, I will introduce it to Dr. Irons to you. And if you have any more questions, feel free to ask anytime during the presentation. Would that be okay with you, Dr. Irons?
Yeah, that's fine with me.
All right, thank you. Before, I totally forgot. This workshop is totally sponsored by our major sponsorship, Vive Healthcare, Jensen, and Gilead. As well as I want to also thank you, the True Translator.
If you guys aren't already patients at Sherbourne Health Center, it's a great place where they offer chiropractic care as well as naturopathic care, and it's completely free. And it's run by supervising naturopathic doctors as well as residents like myself, and then you would get to see student interns who are in their 4th year. And I was told that you guys wanted to learn a little bit more about blood work, so we'll get into some more specifics in a bit. But it's important to get tested, one, if you have any new symptoms that have come up that you don't know what it could be caused by, but also as a way to monitor your health. And so typically, when you go see your doctor once a year, she'll order blood work. But with HIV, we tend to want to see blood work every 3 to 4 months because there's certain markers that we look for to make sure they're remaining stable over time. And also, with naturopathic medicine, we also like to see blood work. So we work with medical doctors in terms of sharing your blood results, and we can take the time to sit down and explain to you what all this stuff actually means. This is just a picture I thought I'd throw in to make it interesting, but anyways. So one really common lab report that we request is something called a CBC. And this is a complete blood count. So this is kind of like your overarching basic blood work that we like to look at first. So if maybe you feel like you're coming down with something, or you're feeling more tired lately, those are signs that something might be going wrong with some of the cells in your blood system. So we order a complete blood count, and that'll look at your white blood cells, and I'll get into a description in a minute. Differences with respect to your red blood cells, and also something called platelets, which is what is involved in blood clotting and all of that. So white blood cells are really important. There's a lot, it's not just one type of cell, we have tons of different white blood cells in the body. This will be run during a complete blood count if we're suspecting maybe an infection, like a bacterial infection or a virus of different kinds, as well as maybe a parasite or even allergies. So the 5 different types of white blood cells that are involved in our differential are neutrophils. Those commonly go up with bacterial infections. Basophils and eosinophils. Those used to be important like a long time ago when humans were getting a lot of parasitic infections. That's less common now. So these cells kind of it's like they get bored in our body because there's nothing actually for them to go and attack. So they actually are now responsible for a lot of the allergies we see today. So these cells start to attack like foods we eat too much, or foods that are not good fits for our body. And lymphocytes, these are really important cells because this is what we mean by like CD4 cells, CD8 cells. Those that travels around our blood system and looks for anything that it doesn't recognize and tries to attack it and get rid of it. So I'll get into a bit more of a description of that in a little bit. So with red blood cells, they're really great markers for us to look for any signs of anemia. So when, just say, the hemoglobin in our red blood cells is deficient, or iron is deficient, we get something called anemia. Or when you're really low in B12 or folate, which are vitamins that do a lot of things in our body, that presents with different types of anemia. So the way we can tell the difference is the size of the red blood cell, and with some red blood cells, they'll be really swollen and big when we're missing vitamins, or they'll be really, really tiny when we don't have enough iron to help make the membrane. So this is what the kind of stuff we look for. And because a red blood cell lasts almost about 3 months, it's a really good marker for any changes that our body has been through in 3 months' time. Instead of just a snapshot of like your blood that day, a red blood cell has a marker on it. For example, we measure something called hemoglobin A1C, which is a 3-month description of kind of how your body handles blood sugar. So when we get our when our doctors order blood work for when they're worried about diabetes, they'll look at something like fasting blood glucose, which is when you're fasting, like how your body is responding to sugar and insulin and what's kind of floating around right now. Well, what about a month ago or 2 months ago? And like we don't really know how it's been fluctuating. So we order something called hemoglobin A1C, which is actually a marker on our red blood cells. And since it's 3 months, they live for 3 months, we can see how our cells have been doing for 3 months of sugar intake. And platelets, so they're also called thrombocytes. They're also important in blood clotting. So when certain medications thin our blood, and we'll order blood tests to see your clotting time and something called INR, which tells us a little bit about how long it takes for your blood to form that scab or something that blocks your blood vessels from bleeding out. This is kind of what a CBC will look like. So most of you have probably seen your blood work, but basically we have a lot of different cells. It'll tell you information about kind of like the size of them or how much hemoglobin is in our red blood cells, and it compares it to a range in which we want you to fit in. So there's ranges that each lab has designed for themselves. So if you go to different places to get your blood work done, the ranges actually change. So that's why it's important to see the range on the side. And whereas it might be flagged in a lab that you could have low iron, for example, or your iron could be within normal limits according to this range right here, but you're still feeling tired and kind of having problems like with hair growth, just say, or muscle mass, we'll look at what your iron actually is. And with my medicine, so in naturopathic medicine, we have our own kind of values of where we want to see your iron or your B12, and that's why I look at these values here, but I also look at how the patient's doing clinically, because sometimes even though it's in a normal range, it could be better, and you could feel better if we got it a little higher. So a couple other things I wanted to talk to you guys about are, so up here there's something called AST and ALT. Those are markers of how your liver's doing. So when our hepatocytes, which are cells in our liver, are compromised, so with hepatitis or with a lot of heavy drinking or problems with cholesterol and moving it in and out, you can develop something called fatty liver or cirrhosis. Those cells destroy themselves and release AST and ALT. And so in order to see how your liver is doing, we don't want to see a high level of AST or ALT ever. Or depending on the cause of what might be causing the liver to kill off some of its cells, we can see if it's maybe alcohol induced or if it's a virus like hepatitis. Does that make sense? Okay, so creatinine, that's another thing we sometimes request to see. That's a marker of kidney function. So there usually shouldn't be a lot of that in our blood, because this is what we're looking at when we take a blood sample and we look for these markers. our kidneys should be filtering that out. So when it's getting higher and higher and higher in the blood, then we know that something's wrong with the kidneys. Another thing that's not on here, but I know you guys wanted to talk a little bit about, is like a cholesterol panel. So what can happen sometimes when individuals are taking medications for HIV is your cholesterol levels, like triglycerides, HDL, and LDL, can go up a little bit. And that can cause a lot of stress for patients because because when those levels go up, everyone gets a little concerned that that means heart problems or risk of heart attacks or strokes or blood clots or something called atherosclerosis. But what recent research is saying is that because it's medication induced, it's actually not really correlated to increased risk of any kind of cardiovascular complications. However, if it was high to begin with before even starting the medication, there's a lot we can do in naturopathic medicine to help bring that down. And I don't know how much you guys know about the difference between HDL and LDL, but HDL, I always say, is like the happy cholesterol. HDL is the good one. So LDL, we'd always want that to be low, whereas if HDL is a little bit higher, that's actually good, because HDL is the one, that's the molecule that kind of floats around our bloodstream, takes the cholesterol that it finds and brings it back to the liver. Whereas LDL is the one that's like, okay, I don't know where I can put the extra cholesterol, I'm just going to put it in the blood vessel and leave it there for now. So other tests we look at that are important are serum B12. So B12 it's a vitamin that we use for a lot of things, but when it gets low in the body, it can cause muscle pain, it can cause nerve tingling and different sensations. It's really important for the health of our nerves. It can cause a lot of fatigue and even memory loss and eventual permanent changes to our brain function. So we want to make sure that B12 is at a good level. And B12 is what you can get from meat. So if you are primarily a vegetarian, this level might actually be quite low. And you can come in and get B12 injections at our clinic. I'll talk about that too. And ferritin, that's what your body's storage form of iron. So that takes a long time to get low, but once it gets low, and it's more common for it to be low in women, it's harder to get it back up. And what a lot of people don't know is actually iron, which is important for feeling awake and vibrant, it's important for our immune system, but it's also, when it's low in women, it can be a cause of hair loss that a lot of people don't consider. Not so much in male pattern baldness, but in women who are losing their hair, and something called alopecia, like spots of hair loss or thinning hair along here, you should get your iron levels checked. TSH is a marker for thyroid health. So if some patients come in complaining of more increased constipation, or again, they're feeling tired, or maybe the opposite, they feel like their heart is racing all the time and they're sweating everywhere. That's when maybe the metabolism is fluctuating because of thyroid hormone stimulation. So when our thyroid isn't working well, this gets really, really high, because TSH is like that messenger that tells your thyroid to make more thyroid hormone. But when your thyroid's slow and not working well, that will be really, really high. But if your thyroid was overproducing too much and your metabolism was running really fast and you're feeling also tired but really sweaty and you have more diarrhea and problems with your heart rate, then we would see a really low TSH. And serum vitamin D. Vitamin D these days is like the miracle vitamin. Everyone is talking about it, but it's because it looks kind of like a steroid. It functions similarly, and it's involved in our immune system. It's involved in the health of most of our organs, and also it can do a lot for our mood. So at this time of year in Canada, we're not getting a lot of vitamin D. It gets dark at 4 o'clock sometimes. It's awful. And a lot of people come into the clinic complaining of something called SAD, or like seasonal affective disorder, which is understandable because the sunshine's gone, it's freezing out, it's winter, and it's just the beginning right now, so we know we have a lot more months of feeling like this. Vitamin D levels can often be really low in those patients. So you can run that once. A lot of doctors don't want to run vitamin D anymore because they figured most Canadians are actually really low. So this is something we give a lot. We give liquid vitamin D to almost every patient. There's a couple more tests that we run when our patients are HIV positive, and that's because we want to look at the functioning of your lymphocytes, like I talked about, those CD4 cells, and to see your viral load. I know that most of you probably know a lot about that already, but I'll quickly go through that. CD4 and CD8 cells are like our fighter cells in the immune system. CD4 is the cell that often is the target for the HIV virus, where it attacks it and destroys it, and it's what it uses to replicate. That's the cell in our body that floats around and notices that something isn't you and marks it and tells the CD8 cell to come and kill it. It's made in our spleen, our lymph nodes, and then in the thymus gland when we're young. That's why when we get sick, our lymph nodes, the ones that are right here and here, you have a lot in here, some by our elbow, and in our groin, they swell. Because when one CD4 cell notices that there's something wrong, it floats back up to the nearest lymph node and makes thousands of them so that it can fight off the infection. But that's why when you go to your doctors, they'll feel around here and in here, and they'll ask you if there's any pain, because when you are fighting an infection, they swell and it can get painful. So one thing that a lot of people don't know about their CD4 cells is it can vary from day to day. And depending on the time of day that you go to the lab to get tested for that, it can change a lot. So we like to compare it to the total lymphocyte count or in a ratio to your CD8s. Because normally we should have a lot more CD4s than CD8s. But when they're compromised and it starts to decrease and that ratio changes, we notice that that can cause a change in how you're feeling overall. So looking at the CD4 count is how doctors know when to start your HIV medication. That's how we monitor progression, and also just to look at how your immune system's doing. But it's important to know that not everybody has the exact same level of CD4 before they get an infection. Some people might have 10,000, whereas others might just always kind of float around that 400 mark. And we want to look at how it progresses over time and not just one marker, because that can cause a lot of anxiety in patients, because for a lot of you, once it gets to a certain level, that's when medication is started. And then patients will often come in and ask me, like, if their levels are just say at 500, does that mean they have to start the medication? And it really is up to you. One of the reasons for why you start it even when your levels are high is because if it ever did drop really, really low, the medication has a hard time bringing it all the way back to how good it once was. So if you start it when it's higher, it's more effective for the medication to maintain that level. The total count, is like the number, like 200. But the percentage is how much of your lymphocytes are CD4s. So they look at the CD8 and CD4 all together, and they want to see how much of the percentage is your CD4s. So it's just a way, instead of counting like 200, 250, 247, the percentage is a bit more accurate because it won't fluctuate as much. So they're going to order your CD4 count when you're first diagnosed, but also every couple of months, basically to see if your medication's working, or also if you're not on medication, just kind of how you're doing overall. But I think most recommendations are to start medication when your CD4 count gets to around 350 cells per millimeter cubed. But I think that depends on your specialist as well. But sometimes they start prophylactic treatment, which means even when it's higher, you'll get other medications that are maybe have a lot less side effects. And that's some of their arguments for starting medication right away and not waiting till anything drops. But there are people who are either slow progressors or who can feel really good at a stable level of CD4 without medication. One thing because sometimes patients come in and they're really stressed because their CD4 levels changed all of a sudden. But you have to note that they're actually lower in the morning than in the evening. So if you change the time that you get your lab work done, that can change your count. If you ever come in and you're sick or you're getting the flu, because it's common this time of year, or if you have a herpes simplex virus outbreak, that can drop your CD4 for a while. Who have very low CD4 counts can feel really great. It's not always a measure of how you're going to feel. And other patients will have really high levels of CD4, but they'll still be getting sick a lot because it's very individual. Before, CD8 cells are the ones that respond to the message from your CD4. CD4 is another name for that is T helper cell. And these are called cytotoxic, like killer cells. They're the ones who come and inject the cells with whatever peroxidase or whatever they have, and it kills it off. But they need to work together, and that's why we need CD4 cells to tell them to come and kill the virus or whatever it is that has entered our body. And another thing we test is viral load. So that's how many virus particles there are actually in the body. And that's the two important things when you come to see even us at the Naturopathic Clinic. We'll ask for your most recent viral load and most recent CD4, along with the rest of your blood work, just to get a good idea of what's going on. A way of monitoring if your medication is working. So if your viral load is remaining stable or decreasing, that means that your CD4 cells are doing what they need to do and it's killing off the virus and your CD8 cells. Does that make sense? So they're opposite. If our CD4s are high, viral load should be low because that means that the virus isn't being able to replicate and it's staying low. And you can see a lot of patients who have either really low viral load on medication, or you can get even to that undetectable stage where it's just basically, it's not called a cure because that you still have HIV, but the rate of transmission is very, very low, and also symptom-wise, most patients tend to feel really good. So yeah, low viral load is between 40 to 500 copies, and then you can have even under that, which is determined, they say undetectable, just because it's hard to count. And that's another thing, so instead of just looking at it as a snapshot in time, changes in your viral load is what we look for. And that's why your doctors and naturopathic doctors will have, they'll requisition the test to see how it is over time, every couple months. And when your viral load starts to go down, that's showing us that the treatment is working, okay? And this is just a little graph to show you. So when a primary infection, you're going to have a lot of CD4 cells because your immune system's healthy. But as the virus starts to replicate inside them, it goes up and your CD4 cells go down. But then your body learns how to kind of take hold of it and keep it at bay, and you can stay in a good zone for a while. But this is why, without medication, typically the CD4 cells eventually drop to anywhere, a level under 200 means that you're going to start to have some of those other opportunistic infections like candida, stuff that your body normally can fight, but it can't without those CD4 cells. And the viral load will go back up again because these CD4 cells aren't there to attack it and keep it under control. So with medication and with other support, like naturopathically, we can keep this phase from happening as long as possible. This is the more interesting part of the presentation. It's what we do at my clinic and how we can help. So I wanted to talk to you guys about a lot of the side effects you can experience, either on medication or without them, and what we can do to make that a lot better. Many of you have experienced digestive problems, but nausea is a common thing I hear a lot in the clinic. Really bad lack of appetite or diarrhea. Diarrhea is something that's really common. So there's a lot we can do to help with that. Acupuncture is really good. I don't know, how many of you have had acupuncture before? 2 or 3, 4, 5, 6? Okay, so that's good. So naturopathic doctors and the interns at my clinic do acupuncture a lot. So patients who come to Sherbourne come once a week or once every 2 weeks to get acupuncture for so many different things. But there's specific points that help to stop vomiting, nausea, to help with dizziness, and to help calm your digestive tract. Another one of the points is called PC6, which is right here in between your two tendons. When you're not feeling well, you can even just press on it and it can feel better. So it's typically about 2 finger breadths below the crease of your wrist. In between, like some of you only have 1, but most of you have 2 tendons right here. It's in between that. At Shoppers Drug Mart, they have something called C-bands. It's like a little bracelet with like a heavier part that sits right on here and presses on it. It helps with like motion sickness, or if you're going on a flight or a boat and you get really like queasy. I do. I wear one. Or if you ever feel hungover. I've pressed this a couple mornings. It's a good point. Another thing is glutamine. So this is something, it's like a little white powder. You pour it into water, stir it up, and drink it. And this is kind of like food for your intestinal cells. The cells that line your intestines should be fused together kind of like this, all the way through, and it creates a layer. But whenever there's food you're allergic to, or medication that's kind of throwing your body off, or any kind of infection that gets in there, can cause those cells to swell, and they kind of separate like this, and then they form cracks. And so like inflammation comes through, water comes through, you get diarrhea, and then food particles that normally shouldn't come through that barrier does get in, and that's when you can see like little particles of food depositing themselves in your joints and causing arthritis and like a lot of really weird stuff. But glutamine helps restore the health of those cells to create that smooth barrier again. So we give a lot of patients who are experiencing a lot of diarrhea, we'll prescribe glutamine for that. And along with that are probiotics. So there's tons of research on probiotics and your immune system, and how a lot of our immune system is actually inside our digestive tract. And so we need the good bacteria to be in there to help promote a good immune system. When you get an infection or you take antibiotics and it kills all of the flora on our body, on our hands, mouth, and our GI tract, it's kind of like our body has to start fresh to like replenish all the good bacteria again. And that bacteria, which actually covers our hands, our face, it's kind of like it blocks the puzzle pieces from being open. And so when our hands are naturally covered with our own bacteria on them, when we like use a lot of hand sanitizer or we take antibiotics, we kill our own protection system that's there to block any like invaders from coming in. So if you're having a lot of diarrhea all the time after antibiotics, it's because lots of tiny little things that shouldn't be getting in there are attaching and causing mini infections. And so probiotics are like billions of good bacteria that come in and just recreate that nice balance again. And then bitters. So this is there's a lot of different herbs like ginger, which is also helpful, but bitters are other herbs that create that like puckering in your mouth that causes us to salivate. Another type of thing that does that is apple cider vinegar, and it's acidic. So when you don't have a lot of appetite or you're noticing a lot of heartburn, it's actually usually because the stomach acid in our stomach is really low. Patients often feel like it's because they have too much stomach acid and it causes all that burning to come up. But really, we need stomach acid because our stomachs are kind of like this, and then there's like a little cap on top. And that cap blocks anything from coming up. But that cap gets lazy when there's not stomach acid to keep it closed. So if our stomach acid's low, then a lot of what's remaining burns up. So taking something like a couple teaspoons of apple cider vinegar right before eating promotes a lot more HCl, so stomach acid, and it prevents heartburn. And when your stomach acid is at a good level, it can actually digest a lot of our food way easier, which then prevents diarrhea, stomach bloating, gas, and like general stomach aches. And it can help promote an increase in appetite. Lemon water in the morning. So what I'm trying to do, but don't do every day, is if you squeeze a bit of lemon into your water before you do anything else. So right when you wake up, go to the fridge, have a nice glass of lemon water. The feeling you get in your mouth when you have anything sour, that like saliva that comes in, all of our organs do that as the lemon water goes down. So like your gallbladder gets ready in the morning, your pancreas, all those digestive juices get ready. And so that way when you start to eat for the whole day, it's more prepared to like really digest our food. So it's not just apple cider vinegar, but it helps though. For everyone to keep track of like herbs versus medications. Naturopathic doctors are trained in looking at all the medications the patient is taking, and there's programs that we use, and also just with research, we know what herbs you can combine and which ones you can't, which ones like would go through the same liver pathways and then block their effectiveness, or if they're more prone to like stomach ulcers because of acid increases or sensitivities, then we do other things. Yeah, but we always get a list of current medications. Yes. So this is a picture of acupuncture. So if you haven't had it, it's just they're tiny little needles inside a tube, and we can either use it for muscle-related problems or for what's traditional Chinese medicine has a bunch of different pathologies, like something like kidney deficiency, or you might have heard of that kind of stuff before. And so we use like organ meridians along the body to put little needles in, and it can help you feel really relaxed and really good. And it doesn't hurt. I wish I had brought some, I would have shown you. Made of needles, we could just try a tiny one, but if you even didn't want that, there's something called tacks and seeds. So like tiny little seeds that we put on. You can do auricular acupuncture, and so it's more about like pressing on the seed and not inserting a needle. So we do a lot of auricular acupuncture to help with cravings or addictions, to help with smoking cessation, a lot of really good stuff like that. And that doesn't always need needles. You can just use these things called seeds. Like we have patients come in who want help stopping like crystal meth, or we have patients come in who are just craving or like alcohol, cigarettes, or chocolate addiction.
How about sex?
Yeah, that too. That too. Acupuncture can help with that too. The thing that patients are concerned with a lot is like lipoatrophy or lipodystrophy, so a change in the way your fat distribution processes work. So some patients will notice that like the fat that normally surrounds their face isn't there, or there's too much, or you get pockets of fat buildup. This is something that's actually a bit harder to do with naturopathic medicine. Like there's a lot of research being done right now on how to help with that, but it is more difficult. So it might just involve switching medications. But we can also do some acupuncture for that. We have patients who come in for that, as well as there's more research coming out now on high-dose fish oil and how that can help. And something, so omega-3s versus omega-6. And one thing that we like to look for in our fish oil is when you turn the bottle around and you see something here, the EPA and DHA. Have you heard about that? So it's not just about the omega-3. We look for a specific ratio in the EPA versus the DHA. So fish oil is used a lot for cardiovascular health, so for your heart. It's used a lot for memory and for like focus and keeping your brain healthy. But it's also used for mood regulation to help you feel a lot more like happy, less depressed, less anxious, and possibly for lipodystrophy, and as well as it really helps decrease your cholesterol levels, triglyceride levels. And so we like to see around 3 grams of EPA. So this one. Or a 3-to-1 ratio of the EPA to the DHA. So that's why not all fish oil supplements are good. What's better is actually just eating fish. So whoever ordered salmon tonight was... But if you ordered if you order the steak, you're good for your B12. They're both good. Sherbourne, we are sponsored by specific companies, so we have supplements that we can give to our patients for free as well. So herbs, tinctures, or acupuncture, or even some supplements, vitamins, we do that, B12. Another one is erectile dysfunction and low libido. So that's a big thing. And actually, when I was an intern at the college last year, this is what I saw the most. And so it's actually one of my favorite things to treat, or low libido in general for women. I know that sounds crazy, but it's because it's really easy to help. So acupuncture, we can do protocols. It depends on your TCM diagnosis, but it's typically like kidney yin or kidney yang deficiency, but it could be a lot of other things. And one of the points that we do is actually for men, it'll be in between. It's on like the perineum, so CV1, and that seems kind of scary at first, but a lot of patients come in for it, and then they could do it every week, and it's no big deal after the first time. We put a little needle in there, so it's just underneath the scrotum, and you can attach it to a little device called an electrostim, and we turn it on, and it kind of stimulates the area. And so after a couple treatments, erectile dysfunction becomes less of a concern, or it can improve the quality of erections. Also low libido, so if it's because of what we say like kidney yang deficiency, we do like acupuncture on the ankles and along the kidney meridian to help with that. But there's other things like counseling. It's a lot of the times it's psychological. So the first time you notice problems with an erection, then you think of it the next time and the next time and the next time, and it keeps happening. So yeah, oh, and celery, because celery is a vasodilator. So it causes your blood vessels to open up and it increases blood flow. So 2 sticks of celery per day can be really helpful. It's true. Yeah, like celery with some almond butter, that's a good snack. So celery, and like L-arginine is another one. That's more, we would give that in a supplement, so it's like taking a little pill. It does the same thing. We would check first to make sure it doesn't interact with medication, but it causes an increase in blood flow. And exercise, because a lot of different exercise training, like resistance training, so with weights, helps increase testosterone, which is important for libido for men and women and for erections. Okay, and heart health, so cholesterol and triglycerides, this is something a lot of people get nervous about because on medication you see it go up. So we do a lot of stuff with that. There's so many dietary counseling or dietary changes we can do with you. 2 tablespoons of olive oil per day can really lower your triglyceride levels, because it's kind of like if you're putting it into your body, your liver thinks, okay, well, there's already some, so I don't have to make it as much today, and so it actually decreases it.
What about coconut oil?
Coconut oil is good too. Coconut oil is really good because it actually like soothes the digestive tract the whole way down. Coconut oil you can rub on your skin for dryness. You can put it on your face if you have acne because it kills bacteria. Coconut oil is also good for whitening your teeth. You can swish it around in the morning. It's called oil pulling. I tried it. It's gross the first time because it's oil in your mouth, but if you swish it through, like you go like this, like, and then they say to do it for 20 minutes. There's not as much research on that right now. It's supposed to like it leaves your teeth shiny. It gives you good face muscles. Coconut oil in my smoothies, and also one really good thing about coconut oil is because it's already fully saturated with hydrogen atoms. When you cook with it, nothing happens, so it's safe. With olive oil, the reason why it's so fluid and liquid at room temperature is because it has double bonds in it, which are healthy for you, but once you cook with it, those double bonds break, and then they change into a weird pattern that can kind of simulate like a trans fat. So it's not good, even though sometimes I do, it's not good to cook with olive oil. You should switch to coconut oil. I like the taste, some people don't, so I don't know then what. There's other oils you can use, but it's good. Almonds are also another almonds and avocados are like really high in plant sterols that can help decrease your cholesterol levels. And high fiber diets are good too, because anything that's getting your body to like it bulks up everything in your digestive tract and moves it all the way through, means there's a lot less recycling going on and taking all those chemicals and different forms of hormones and bringing them back into the body. Okay. And CoQ10. CoQ10 is really good for the heart, so it's an antioxidant for our heart. A lot of patients, if they're on a statin drug, which lowers your cholesterol, it depletes your body's natural stores of CoQ10, so we always give it. And it can lower blood pressure, it's good for the brain, it's a great nutrient. For headaches as well. Sometimes headaches are just caused by a lot of tight, sore muscles in the upper back and near the head. It can also just be because of a lack of water intake during the day. Magnesium often helps with that. We do acupuncture. It's something called trigger point release. So if you take a sore muscle and you can like grasp the muscle in your hands and you kind of move the needle a little bit, it releases the muscle, and it can feel really good.
What about
and hydrotherapy? So like switching up hot and cold towels can bring blood. Like it causes the blood vessels to kind of increase and decrease, and it helps with nourishing your muscles, but also helping to relax them. And tingling are a really common concern. We see a lot of that. I see it every day at Sherbourne. And something I found to be really helpful is acupuncture. So if you have tingling down your hands or in your feet, we do acupuncture in these points. And you attach it to like an electrostim device, and it causes a lot of relief for that. But also tight muscles can be a thing. And so we do a lot of B12 injections. So we can either do it into the arm, which can help with the tingling and like the neuropathy, so like it helps increase the health of your nerves and your muscles. We also can inject it right into the back if you have lower back pain. It can help with overall energy as well. And Epsom salt baths are great for sore muscles. As well as just making, your muscles are made up of so much water, and we all just drink coffee and tea all day, and especially in the winter it's hard to drink a lot of water. So if you start your day off with the lemon water, you've got a full glass right there, and if you carry around a little water bottle with you, then that's a way to help remember to drink water during the day. If you aren't sure about like what naturopathic medicine does, I hope this helped a little. We do nutrition counseling. We do a lot of herbs too, so like herbs to help with any kind of illness, so sore throat or heart health. We do homeopathy as well. We do a lot of counseling, so just coming in and talking to us about like relationship stuff, or like if you're not feeling happy or you're feeling stressed at work, we talk with our patients and try to give advice. We do massage sometimes, and we're not as good as massage therapists though, so really I don't know if you want that. And hydrotherapy, so we can do a lot of, at one of our clinics we have a way of doing stuff for, we have a sign machine, so we do something called constitutional hydrotherapy, but a lot of good ways of teaching you how to use hot and cold water to help with some of your symptoms. Nastasia Irons, so nirons@ccnm.edu. And then, but if you guys call the Sherbourne Health Center, or like you said, your support workers can get you guys home treatment. Yeah?
Yeah, thank you. We have a gift from ACAS too. Thank you so much.
Thank you, Dr. Irons.